Today we're going to go over an exercise to help strengthen the really deep external and extensor muscles of the hip. So we're talking the Obturator, Externus, the Quadratus, Femoris, and the Gemelli muscles. They are deep muscles right underneath the hip here, and if they are impinged, particularly in our hypermobile population, when we have a turned out foot or an anteversion in the femur, what we're going to have is a compression behind here where the sciatic nerve passes behind that muscle. So if those muscles aren't able to engage properly, we can end up with this constantly turned out position of the foot, and then it means that those muscles can actually compress the sciatic nerve. So we're going to do a little exercise to strengthen them, but it's a little bit tricky, so follow along. To do this one, you're going to grab a foam roller and you're going to keep your hips stacked so they're on top of each other, and you're going to bend your top knee so that it sits on the roller. We want that knee out of the way. Then what we're going to do with the bottom leg is we're going to push that leg into a bit of extension, okay? So from here, what we want to do is we want to create an internal rotation of the foot, so the foot's lifting up to engage this muscle under here. Now, what you might find is that this is a really easy exercise to cheat with, and you'll end up getting quite a lot of range, but you're not actually using the muscle that we want to target. So one trick you can do is try and really get that hip into extension, and then from here, we're lifting it up. We really want to focus on engaging the muscles under here, but if you still can't feel it, grab a friend or your husband to pop their foot in front of your knee to kind of pin it there so you can't move it. And then from there, you're going to get a much more true reflection of what range you have in that deep hip area, and you should feel a really deep muscle sensation under here, so right underneath the butt. But this is a condition, so it's called ischiofemoral syndrome, where there is a constant compression of sciatic nerve, and it creates this really deep, almost like nerve sciatica kind of nerve numbness pain that can either be very localized or it can shoot down the back of the leg and mimic either sciatica or a hamstring tendon issue. So by strengthening these muscles, what we're doing is helping reduce how much compression we put on that nerve and just try and realign the hip. Really important for our hypermobile population. But yeah, if you can get a friend to help pin your knee there, you definitely feel that the muscle works harder than what it does if the foot's not there, and you can get just excessive range, and it's not quite a true reflection of what that deep hip can do. So we can give this one a go, try about 10 reps until you feel that deep burn, and then switch sides.